So hi, I'm Jeff. I'm usually behind the camera, but these are strange times. So I'm here with my wife, and we have a story to tell. So it started Sunday.
Yes, well, actually Saturday I found out that a coworker of mine had tested positive for COVID, and so I had a cold, and so I was having like sore throat, cough symptoms, and so I got worried that maybe I should be tested. So we didn't know how to do that. So the first thing I did is I called on, it was on Saturday, I called my urgent care that I would normally go to, even though I wasn't feeling like an urgent care situation. I just had a cough and a cold, and I asked what to do. And they said, don't come in, but they gave me a virtual website to go to that was
Multi-care virtual.
Yeah, multi-care virtual. And so I logged in on that and answered a number of questions. And then within a day, they called me back and said I'd been referred for testing. And so on Sunday, went to Indigo Urgent Care on the north side at Shadle.
And you were told to call. You had a 12:30 slot. You were told to call when you got to the parking lot. We had to drive around back, and a nurse came out the service door and waved you into the building, which we all thought was funny.
Yeah, very unusual for a medical visit, but it makes sense in light of they want to minimize exposure. So I went in the back door. It took about 3 minutes. They did a nasal swab, and the nurse was all in, the same kind of nursing outfits you're seeing on the news and in China. And then I left, and
then we waited.
Yeah, and it's a long wait to find out. I mean, you want to know, and
you're trying to tell your friends it's a possibility that you may be infected, and that's not a fun situation to be in.
Yeah, you want to hope that you haven't, talked to anybody or affected your friends, your family, my older parents, or your people you work with, and so it was a big concern. And then we waited until
this
today.
Morning, Thursday. Now 4 days later, you got a text or an email.
I got an email from Multicare that I had new data in my chart, so I logged into the chart, and then I was able to see test results, and I was able to see that the test was negative.
Yes, and it was sort of hard to read. The test, it says negative at top. It almost looks like there's two tests they're running, but one was negative and the other one looked inconclusive, but had a bunch of doctor stuff.
The second one just explained the test, but it was in very scientific terms. So at first I didn't really understand what that was, but I definitely understood the first part that said that the test was negative. So it was
fine.
A big relief, stressful time, and I know there's lots of people in that same situation, and it's a tough wait.
When there's some colds going around that are like COVID, you had sore throat, you had a bad cough.
Yeah, there's a lot of overlapping symptoms, and they tell you on there, they say, it's worrying if you have overlapping symptoms, and so they're just trying to figure out, who has the normal spring things that go around versus who has the COVID-19.
So we're all better now, except you still have the cold.
I still have a cold, but I'll take it, yeah.
I'm really grateful for them for sharing that story, because I think a lot of people are in that position where they just, we normally get sick at this time of year, and so just
or
trying
allergies.
to figure out, and I'm glad that they also walked us through the process of how they did it, because a lot of people are saying, well, I don't necessarily have a primary care physician or a normal doctor that I go to, but to call in urgent care and to know that that resource is available, even if it means getting a referral to go to the drive-through screening down at the fairgrounds, we know that those steps are in place.
So, and also Jeff didn't come to work. Once they went and got tested, he stayed away from work until, I don't know if he came in today or not, probably caring for his wife. But the point is that if she was possibly infected, he wasn't going to come back into work because we can't get sick.
Yeah,
And you hope that the fire, first responders don't get sick, and we hope the hospital people don't get sick. So there's just certain things there. And I should say, Anna didn't really downplayed it. Jeff said it was the worst cough he has heard from her. She was really, really sick.
And that's
but
kind
it was
of
just a normal sick.
And it increases the uncertainty because people are so fearful at this time. So just really glad that they're both okay, especially Anna. Hope she starts feeling better very, very soon.
Yeah, we love you, Anna.
Yeah, absolutely.